Okay, influenza, whenever we hear influenza or the flu, we're just talking about an acute respiratory disease that usually has a pretty short duration. There are three major strains of the flu, it's A, B, and C, but each strain mutates and changes and produces subtypes and everything, and that's why we can never truly build up immunity to influenza, because there are way too many subtypes and too many different things that can contribute to the actual disease. It's transmitted through your respiratory tract, and the virus, like we said, changes from year to year. So antibiotics aren't effective, antibodies aren't effective in preventing the infection from year to year. You can never actually build up enough antibodies to prevent yourself from every strain of flu. Even when we get the vaccine, we're still at risk for different strains. This is why we have to get the vaccine yearly also, because the virus changes from year to year and it mutates and creates all those different subtypes. And so the vaccine each year is designed to be most specific to what these scientists are recognizing to be the most common causes of influenza within that specific year. So it's very important to know that you're never immune. It's also important to know that you need to get the vaccine every single year, and that there is still a possibility that you might get the flu even with the vaccine if after they've done all of the research and everything, the strains still have mutated even more. And that's what gets kind of scary. But we just need to do as much as we can to prevent ourselves from getting the infections and prevent our family members from getting the infection as well. Fatalities occur whenever some kind of secondary infection occurs, especially in high-risk patients, and typically that secondary infection is going to be bacterial in nature. The signs and symptoms of the flu, you all know them. They're body aches, fever, sometimes vomiting and nausea and everything as well. Look in your book on page 271, and in that table it's going to give you an exhaustive list of signs and symptoms of the flu. Not everybody's flu presents the same, and so it's important to know all the different types of signs and symptoms that can occur so that you can be on your toes and really recognizing whenever a patient does have the flu. To diagnose it, we're really just looking at the signs and symptoms. We can get a chest x-ray, and a lot of times that's to rule out pneumonia, and it's also just to make sure that your chest and your lungs and everything are still functioning appropriately. We will want to get sputum studies just to rule out any other kind of disease, and especially make sure we don't have any secondary infections as well. To treat it, our goal is prevention, because there's really not a whole lot we can do to treat it. We can give Tamiflu, but we try not to give that very often, because then that decreases the effectiveness of antivirals in your system. But really what we want to do is rest, fluids, and just stay away from people. The best thing that we can do is to educate people on getting an annual vaccine, and I hope that y'all know all the different details about the vaccines. That is in your book, so make sure you review that, because you will be tested over the vaccines. Questions you need to ask people, and things that we need to check on, like allergies and things like that as well. The patient, once they have the flu, if they become hospitalized, they need to be on Airborne Precautions in contact isolation. The whole goal there is just to prevent spread of infection to hospital workers, family members, and anyone that would be walking the halls when you open and close that door, because it is highly contagious. So we want to avoid anybody that we know that is infected with the flu, and practice good hand hygiene. Education is key, and awareness is key. Here's a question. Let you pause, see if you can answer these questions. Okay, here's the answers. Check yourself, see if you're right, and we'll talk about it later.